In this video, we're going to talk about the diagnostic evaluation of language variation. This is a really important screen that you can use. You don't have to use this one, but it is something that you do want to be mindful of if you have a particular client who potentially has a language difference rather than a language disorder. You would want to administer something like this to verify whether it is a disorder or a difference, because we don't want to be treating kids who just have language differences. So this is one of the options that you have. You have a testing little easel that has the pictures in it. You have a protocol and a manual. So not a whole lot to this. It is just a screening test. So it is not too in-depth in the fact that it doesn't have a lot of materials. One of the really nice things about this particular test is that all of your directions are right here on the protocol, so you're not switching between the manual and the protocol. Everything is right here. So you can see that you can repeat items, but one word of warning, you cannot paraphrase or reword anything. The manual is very, very clear that you have to read things exactly as they're written. So make sure that you are mindful of that and that you don't change things. Your directions are all in bold, like many of your other tests, so you'll just read those directions. You have some items to start prepping the child, as with most tests. And so, for example, on this one, you are going to say these sentences while pointing to the picture for this first one, and the child then just repeats what you say. Then you'll mark if what the child says, so how they've repeated after you. And for this particular section, you are only scoring the A and the B parts. So, and it says that right here on the directions as well, in case you forget that. It says right here that you're only going to count up the number of responses from A and B. So this is just determining the variation that the child has in their language. And again, you will see that the items, this particular part 1, item 11, will correspond with item 11 as well. So I see a wagon. That's what it says here. I see a stroller. The girls always push the wagon, but the mom always, and then you pause and let the child respond. The words that are in italics, the directions tell you that you want to make sure that you emphasize those so that the child knows exactly what you're talking about. And so that is the first section, the language variation scale. So pretty straightforward on this one. Once you have calculated the language variation, you can then look at the diagnostic risk status, which is just a couple pages further down in your book. You will then flip to the next page of your protocol, and again, your directions are above. So you have these directions that you'll read to the child. Everything you're saying is in bold, and then you're going to mark how the child responds. For this particular part of the test, you are only counting the number of responses that the child has in B, C, and D. So you will not count A, only B, C, and D, and those scores are going to be put down here. The last part is a non-word repetition task, where you're saying words that are not real words, and you're having the child repeat, and you're marking the sounds that the child is able to or not able to produce. So you'll mark off the ones that they have errors on, and then you will write in here whether the child has 0 to 1 or 2+ errors, and that's how you're going to record how the child performs on this particular part of the test. You'll put those subtotals right there, and then that's going to get converted onto the last page. Once you've completed the test, the way that you are going to score and make your decision is you'll come to this back part of the protocol and you'll find the child's age, and then you're going to write in here, you're going to put in the responses from A and B from that language variation status. And again, the directions are right here, so if you forget, it's right on the protocol. And then you'll mark if the child is at the criteria or above it or below the criteria. So let's say you have a 6-year-old and in A, they get a 10, that would be above the criteria. But let's say in B, they get a 3, that would be below the criteria. So you'll just circle the plus or the minus, and that gives you that response. And then right here for your diagnostic risk status, you are going to calculate the sum of that B, C, D from page 5. And this is the child's diagnostic error score. So you'll put those in here. So what was the sum of B, C, D, and what was the total number of errors? Again, you find the child's age, and then you mark where the child falls. So are they at risk for a disorder? And here is the legend that goes with that. So a child falling in this white, they're at the lowest risk for a language disorder, as opposed to any of the kids falling in this darker green. Those are your highest risks for disorder. So there is one more page on the back. So any additional information that you need to collect about this child, it would go here as well. Pretty quick, straightforward, but something that is really vital. So always keeping in mind that we cannot say that a child has a disorder if they just have a variation in their language. So we do need to make sure that it's not a variation and that we are actually seeing a disorder in the child before we recommend them for services.